Hi, thank you everyone for joining us tonight at this COVID-19 virtual town hall. Some of you are on the line, some of you are participating on the internet, and we welcome all of you. My name is Peggy Sattler. I am MPP for London West, and I am very pleased to have Dr. Chris Mackie, the Medical Officer of Health for the Middlesex London Health Unit, on the line with me to help answer your questions. You can submit a question anytime by pressing *3 on the phone, or you can type your question into the question field if you are online. Before we get going, I wanted to start with some opening remarks, some reflections about the past 14 weeks, and then Dr. Mackie will say a few words, and then it's over to you. So in Ontario, we have been in a state of emergency since March 17th, and I know hearing from you on the phone and in your emails what a difficult, challenging, and frustrating time this has been. We have fielded hundreds of phone calls. We've received thousands of emails, and we have tried our best to give people the information they needed, even as that information was rapidly changing. So initially, right after the state of emergency was declared, there was a lot of panic and uncertainty. You know, we heard from people who were worried about how they were going to pay the rent, how they were going to pay the bills. We heard from essential workers who had to continue to go to work every day, and healthcare workers in particular about how they were going to keep themselves safe. And for healthcare workers, there was a real concern about the shortage of PPE and whether it was the right kind of PPE. These were huge questions that people were asking us initially, and also lots of questions about COVID testing and the length of time that it took to get the results of the testing. And then we saw the federal support programs start to roll out. People started to learn about access to the CERB, the wage subsidy, and so the focus shifting a bit. And at that point, we started hearing more from small business owners in particular who were worried how they were going to survive the shutdown and come through the other side. And at that point, we started hearing those horror stories coming out of the long-term care sector and the devastating impact of the virus among seniors living in long-term care homes, and the neglect and the horrific conditions that they were living in that were revealed by the Canadian Armed Forces. We also started to get more and more emails and calls from people who were already struggling, so seniors, persons with disabilities, people living in poverty, people experiencing gender-based violence. These are certain groups in our community who were particularly hard hit by the impact of the virus and really felt that there weren't sufficient supports to help them through. And so now we've shifted again with the reopening of the economy. Questions have changed again. A reminder, if you want to ask a question, press *3 on your phone. But the kinds of things we've been hearing in the last couple of weeks are about the safety of workers who are returning to work, and what does that mean in their workplace. Lots of concerns about access to childcare for workers who are being called back. More recently, with the news last week about the return to school in the fall and the different options that might be implemented. Lots of parents are wondering how they're going to manage that, and there's also concerns about the mental health fallout of the pandemic. and the surge in demand for services in our community, and also as elective surgeries start to get back up in the hospital. So these are the kinds of issues that we have heard over the last 14 weeks. Tonight is the opportunity to hear directly from you as to what new questions you may have, and also to hear from Dr. Mackie. So again, a reminder to press *3 to submit your question. And now I'm going to turn it over to Dr. Mackie to say a few words. He is the Medical Officer of Health and the CEO of the Middlesex London Health Unit. We've been very fortunate in London to have his leadership and the outstanding team he has at the Health Unit. He's been a champion of harm reduction, ending poverty, race-based data collection, and more. And I want to give a shout out to his team. They were featured in a CBC National News story about contact tracing. I know he has worked tirelessly throughout this pandemic to get reliable, trusted information out to Londoners. And now I'm going to ask Dr. Mackie to say a few words.
Thanks very much, Peggy, and thank you for the opportunity to engage here. That was a great summary. I think you pretty much said it all. I think you probably answered all the questions. I'm joking, but I've been very impressed, Peggy, with how on top of this issue you've been, and grateful for your help getting the message out to all the people that you serve. And, you know, this is a great opportunity. I love hearing directly from people. I do try to engage a bit through social media, a little bit on Twitter, but so often those conversations are more about people wanting to give their opinions, not actually seeking information. So very grateful to you for this opportunity, and to everyone who has made a bit of time this evening. This is the third pandemic of my career. When I was finishing medical school, SARS hit. I was in Winnipeg. Essentially, Manitoba was untouched. The economy of Toronto alone was hit by about $1 billion. The deaths around the world counted in the hundreds, not nearly the levels that we're at now. The H1n1 pandemic, which was a few years later, was an influenza pandemic, an influenza virus that definitely came in a strange way. It was out of the influenza season. It hit very hard in terms of the spread, but it wasn't actually significantly different from a normal influenza season in terms of the total number of people affected. What we have here with the coronavirus is we have the combination of those two. You have the mortality level of SARS, a very serious illness for vulnerable people, particularly elderly and those with chronic disease, but it spreads as easily as influenza. So you have the high case counts, and on top of that, the high mortality rates. And so we're seeing, you know, we're well over 2,000 deaths in Ontario now. This has become one of the leading causes of death in our society. Our whole society has worked hard to address this issue, and we've made huge strides in doing so. We're nearing the end of the first wave of this pandemic in Ontario and here in London and Middlesex, the communities that I serve. And we are also preparing for future waves. Coronaviruses, there are many. We test about 50 to 100,000 people in a normal year for coronavirus. And this coronavirus season is essentially identical to the influenza season. It's a little bit more spread out, but you know, there's a peak somewhere around late February, and it lasts till the end of April usually. And so there's lots of reason to believe that this coronavirus will become seasonal, and we'll have future waves either in the fall or in the winter when influenza starts to come back, and those droplet spread respiratory illnesses become predominant in the community. I'm going to leave it there. There's lots and lots to talk about, but I'm more interested in your questions. So Peggy, back over to you.
Okay, thank you very much, Dr. Mackie. Before we get to questions, I did want to state at the outset that I am elected to the Ontario Legislature, but I am not part of the government. So I know that many of you have come to my office to ask why the government did this or why the government didn't do that. And unfortunately, I don't have those kinds of insights as to why those decisions are made. But I can speak to the impact of those decisions on the people in my community. So with that, I wanted to go to the first caller, Brenda. And Brenda has a question that will be a good question for Dr. Mackie. So Brenda, are you on the line?
I am. Hi. Yes. Well, I hope it's a good question. It's a fatiguing question about masks. I'm of the understanding that a mask is supplementary to physical distancing. So when you're in a situation where it's not possible to physical distance, then you put the mask on. And that gives you that extra little level of protection. But what if you're in a situation where you're having a doctor's appointment or a dentist's appointment? Dentists, holy crow, how can they possibly have a profession and avoid getting in contact with this? I just can't imagine it. And I just really am getting a little upset about the arguments that are going on all the time, because these fashion masks clearly say on the label, and some of them are going for as much as $20, non-medical. Now, I understand covering my face with a do-rag when I'm cleaning the bathroom, but that I don't believe it's going to prevent me from getting COVID. So what's the difference between a double layer of cotton cowboy scarf and some of these fancy elastic things that they're selling around town? And how can we actually purchase a medical grade mask if we're not in the medical profession ourselves? Is that possible, or is that just like a trade sort of thing or industry? And
I think, Brenda, that's a very good question. And Dr. Mackie, would you like to give us some advice on masks?
Yeah, this is one of the toughest questions that we've had throughout the pandemic, and even as things evolve and masks are more readily available, it remains difficult. There is research showing that medical grade masks are more effective at preventing this spread of coronavirus and related illnesses. There's no doubt about that, and it's difficult to get medical grade masks. There is a worldwide shortage. There is huge pressure from primarily healthcare providing organizations that are using huge volumes of those with every patient that they see, and so we're in the public having to make do with alternatives. And you're right that multiple layers of cotton can approach the effectiveness of a medical mask. The masks that I wear, you can purchase masks that are similar to medical grade masks but aren't certified through Amazon. That's where I get what I've been using in public. And what you really want to try and look for is a mask with that metal bendable bar at the top so that it can conform around your nose. When you've got that, it helps to seal the mask to your face, and that increases the likelihood that you get some protection to yourself and from you to others if you happen to be carrying the virus and not knowing it. But the most effective prevention measures are not masks. It is physical distancing. It is hand washing. It is staying home when you don't need to be out, and avoiding those, and staying home if you're sick particularly. And so that's really where I would say we want to try and focus our efforts, because those are much more proven interventions. They're not as sexy, to be frank, as wearing a mask, but those are the ones that work. Hand washing, keeping your distance, staying home when you're sick. So I'm not sure if I've lost connection, but I'm not hearing anyone right now. Anyone hear me?
Sorry, it's Peggy. Dr. Mackie, can you hear me now?
Yes, got you there.
Okay, sorry. Press *3 if you have a question, and we'll try to get you into the queue. But next, we're going to go to Shirley. She has a question about retirement and nursing homes. Shirley?
Yes, hi, Dr. Mackie. I was just wondering if you had any idea when it would be safe to visit a friend or a relative in a retirement home or a nursing home in the London Middlesex area.
Sure. And we've actually, the provincial government with its Stage 2 announcement did lay out a framework for visiting homes. So that is available now, at least from a provincial regulation perspective. It's up to each home when the criteria are strict, and the home has to take, precautions. Visits are primarily outside. They have to be supervised by a staff person, wearing masks, and the biggest hurdle is that visitors have to have had a test for the coronavirus come back negative within the previous 2 weeks. So it is kind of a high bar to meet, but it is theoretically possible. Dearness Home, for example, announced today that they are now prepared for those that have had their negative tests and can bring a mask. They're prepared to have visitors start there. It's a scheduling issue because there's staffing pressures, and the requirement to have a staff involved in each visit obviously puts pressure where they're on a system that is already under pressure, but that is available. In terms of safety in our community, our numbers are really quite low now. For the last week or so, the average cases has been about 2 cases per day, and we're testing nearly 1,000 people a day in Middlesex and London. So the percentage positivity is 0.1%, like very low positivity rate. So that's quite reassuring in terms of the risk that you might be carrying and not knowing it being fairly low.
Okay, thank you very much, Dr. Mackie, for that answer. I do know that this is a concern that I have heard in the constituency office. We have had a long-term care system that for too long has relied on family members providing or supplementing the care that's available for the loved ones because of the shortage of staff. And when we see the 1,800 deaths in long-term care facilities across Ontario, much of it is due to ongoing issues with a shortage of staffing and a lack of funding for long-term care facilities. And it's been very, very, very hard for family members not to be able to go visit their loved one who is in long-term care or a retirement home. So I know a lot of people are really looking forward to that. I wanted to go next to a question that was submitted online, and that is it necessary to sanitize groceries? That is a question from Janet. So, Dr. Mackie, that seems like a good one for you.
Sure thing. Thanks, Peggy. So groceries, let me actually broaden this a bit. There are very few documented cases of spread of the illness that isn't due to face-to-face contact. In terms of people having contact with, an object that somebody else might have touched, we get the question about groceries. We get the question about, I live in an apartment building. Do I have to worry about pushing the elevator buttons? It is good to be careful about those things. Wash your hands before and after. Avoid touching common objects if you can. If you're in charge of any of those facilities, make sure that you are absolutely washing down those surfaces frequently. But there really is a very low risk. There's a great example of an outbreak in a Taiwanese office building. And this was a large call center with a fairly dense kind of office environment. And 200 people worked on the floor of the individual. The first individual became sick. On the side of the floor that the individual worked, there were dozens of cases. On the other side of the floor, there were a handful of cases, less than 6. And up and down on other floors of that same office building, there were no cases until later from people that were exposed to other ways. And so what we know from that sort of example that was really well documented is that those contacts with, door handles, groceries is another example. It's a theoretical risk, and certainly it is possible that you have a contamination there that does make you sick, but it's much more likely that you get it from face-to-face contact close to the person who's ill.
Okay, thank you very much for that. A reminder to folks who are listening in online or listening in on the phone to press *3, and if you are on your computer, you can enter a question in the question field. I am going to next take a call from Elaine. Elaine, you have a question for us?
I do.
Great.
I sure do. Hi, Dr. Mackie and Peggy. I have 3 grandchildren, little ones, and I am so worried about seeing them go back to school in September. It just feels like we're not getting much guidance at all from the school boards with what they're planning to do with the kids to keep them safe. When they say 15 kids per classroom, I just can't figure out how they're going to do that. Are they going to hire extra staff and double the classrooms? How are they going to keep kids apart?
I think that those are excellent questions, Elaine. I have exactly the same questions, and we have asked the Minister of Education for some more clarity. I know that a lot of parents, first priority is to make sure that the kids will be able to return to school safely. But these 3 scenarios that the government has directed school boards to prepare for, it's going to be very challenging to be ready to follow one of those scenarios in the fall with just a couple of months to plan. And as you point out, there will need to be a significant investment of funding. If there's going to be these small cohorts of kids, there's still going to be kids who are learning online, who are at home. If there's going to be an alternating day, and that has created a whole new set of pressures for parents who don't know how they will manage to send their kids back to school in an alternating day schedule when there's no child care available, and will they be able to make accommodations with their employer? But there are also the safety concerns. Obviously, when you have that, there will be a need for much more intensive sanitization. You'll need to have more custodial staff. All of those factors have to be taken into consideration. I've also heard about transportation, like ensuring physical distancing on school buses. How that's going to be managed? Will you have to have double the buses on the road, or all of these things have to be fully thought out. There is a lot of people have read the report from sick kids that said, just kind of go back to a normal school schedule. Other public health experts have weighed in with some other advice. But most of all, what needs to happen is collaboration with the people on the ground. So the frontline educators who are going to be delivering education in the classroom in these new, the new way of doing things that's going to be required because of COVID. But basically, the government has left it up to the school boards to figure things out and to consult with the local health units to see what would be right for individual communities when we get to September. So at this point, I'm going to turn it over to Dr. Mackie because you'll be working with the school boards in our region to try to figure this out for the fall.
Yeah, I think it's fair to say that there is a lot of work left to be done to figure out how we're going to try and do school as safely as possible. This is probably a good time to point out there are downsides to many of the public health interventions that we've had to, implement. We know that income and equality are major determinants of health. We know that social contact is a major determinant of mental health. And so as we shut down the economy and isolate people in their homes, that has an impact on health. We can't deny that. And there comes a point where that will offset the benefit to the infectious disease risk around the coronavirus. So, I think there's no doubt we have to get school running in the fall. There's no doubt that there's a lot of work to be done to figure out how to do that as safely as possible. And it's also impossible. It is impossible to bring school back and have zero risk. We're going to have to figure out as a society what level of risk we can tolerate and what level of risk is unacceptable, and we need to invest in staffing and facilities to bring that level of risk down as low as possible. I'm going to make a comment that's it's going to sound partisan, but it's an obvious observation that I think everyone has made. And I want to also be clear that I'm very supportive of the work that Peggy has done in her riding, and also have made the same offer to be participating in town halls for any of our MPs or MPPs who are interested in doing so from any party. So certainly nonpartisan from my perspective. But this is a government that has expanded class sizes, and that has implications at a time like this, where we absolutely need small class sizes to minimize the risk that one kid can make 50 or 100 kids in the school sick. So that's something that there's no doubt that there's a resource issue. Our schools, like the long-term care system, are under huge pressure from a budget perspective, and the risk can't be reduced to an acceptable level without investments.
Absolutely. I couldn't agree with you more, Dr. Mackie. Thanks again for that question. I want to remind everybody on the line, if you have a question, press *3, and we'll try to get to your call. Next, we're going to go to Sandy, and she has a question about visiting relatives. So, Sandy, are you on the line?
I am right here.
Great. Do you want to ask your question?
Yes. Who am I going to talk to? Okay. My question would be is that I'm a retired or a senior person, and I have relatives out of province, and I'd love them to come to visit me. If they do, would they have to quarantine themselves once they are with me in Ontario?
Yeah, I appreciate the question very much. There hasn't been for some time, there hasn't been a recommendation to quarantine between provinces. There were earlier on, it was mostly the other way around. Ontario's rates were higher than, say, the prairie provinces. But we, at this point, there's no quarantine for travel within Canada. The rates of illness, if depending on where your relatives are living, continue to be highest in Quebec. The rest of Canada is substantially lower. Ontario is, last I looked across the provinces, Ontario was second highest rate. The western provinces having been hit earlier and their wave passed more quickly. But and even within Quebec, the ongoing transmission is quite focused around Montreal. There is much less transmission of the virus outside of Montreal within the province of Quebec. But essentially, there's no quarantine between provinces, and there's no prohibition at this point of visiting family and friends.
Okay, Sandy, so enjoy your time with your relatives. Another reminder to everyone who is listening in, press *3 if you have a question. And next I am going to go to Gail. Gail has a question about meeting with friends. So Gail, do you want to ask your question?
Yes, thank you. I'm going to be meeting with these 3 women. I haven't seen them for a long time. I think they've all been under quarantine. I only go to a grocery store and come home. I wear gloves or I take a soap and water cloth with me and I wear my mask. So when I'm with these 3 women, what precautions should we be taking? We will be outside at a very large table where we can sit 6 feet apart, but we will be using implements, touching pens and pencils and different things like that, little knives. We're going to be making cards. So I'm wondering, what precautions should we take?
Well, first of all, thanks for everything you've done to be careful up until now. It sounds like you've taken, and your friends have taken many steps to protect yourself and others, and that's why we are seeing this pandemic waning now. So thank you. The situation you talk about, first of all, you've got space. That's great to keep your distance. Second of all, outdoors is much better than visiting indoors. The air easily disperses outdoors. Indoors, the air is much more concentrated. It doesn't move as easily. And what that means is that you're more likely to be exposed to enough virus to become sick if you're in the presence of someone who's ill. Outdoors, and the dose is really important. If you get an exposure to a very small amount of virus, it's very unlikely to cause illness. You require a higher dose for the virus to take hold. And so that's why those outdoor events are very low risk. So, we saw that gathering of 10,000 people a couple of weeks ago in Victoria Park for the Black Lives Matter protest. We only had 1 case associated with all of that, and that person didn't even have symptoms. So it might have been a false positive test result, but in any case, we did not see spread associated with the gathering of 10,000 people. Vast majority were masks. When I sat in my car and watched the march go by, and it looked like well over 90% of people were wearing masks. And the fact that it was outdoors and people were able to kind of keep their distance for the most part made a huge difference. So you're doing those things right. And then on top of that, if you're sharing objects, it's about hand sanitizer. Doing your best to avoid touching your face is something that many of us do unconsciously, so maybe helping each other to watch out for that, and then having that hand sanitizer there. So if you notice yourself or others touching your face where you would potentially contaminate your hand and contaminate those objects, just use a hand sanitizer.
Okay, thank you, Dr. Mackie. So meeting with friends outdoors would be a great idea, and wearing masks as well. Next, I am going to go to a call from Mary. Mary has some questions for Dr. Mackie to get his advice about bubbles. Mary?
Thank you, Peggy. And I want to say, first of all, from my husband and myself, that you and your staff have done just a fabulous job of keeping us connected and keeping us informed, and we appreciate it so very much. So,
thank you.
And I would also like to say to Dr. Mackie, thank you for being the voice of reason and common sense for our community, not just with the pandemic, but with your approach to so much of our public health needs. So my question is, we are seniors, we have family out of town, we are not in a bubble. Our family, two different families in two different small communities outside of London, they are also not in bubbles. But we understand from the government that we are now allowed to have some kind of close contact as a bubble with this family. So we were told last week now we can hug. Well, what else can we do, Dr. Mackie? What would you say is safe? Can we share communal meals? Can we spend overnights with our family? What is considered to be a safe level of contact beyond the hugging that we were told would be just fine? So.
Thanks for the question, Mary.
Yeah, very much. Very kind of you, Mary. Unfortunately, only you can answer that. I cannot tell you what is a level of risk that is acceptable to you. Yes, sharing food increases the risk. Yes, hugging, kissing increases the risk. But is it worthwhile for you? Do you know people? Do you know how well they've been, keeping to a closed bubble? Do you know how well they've been monitoring their own symptoms, using hand sanitizer, using masks when they can? These would be, like, every situation is so dependent on those details, and most importantly, whether it's worthwhile to you. My dad is 82, and he had a heart failure episode last month, and it was pretty scary. And my family always goes up to spend time with them in the summer, and we have to make the decision whether it's worthwhile. I've got 3 little girls. As much as I douse them in hand sanitizer whenever I can from head to toe, there's no way, there is a level of risk if we bring them up to visit. And also, he's 82 and he's in heart failure, and so how much longer, are we going to have the opportunity? I don't think coronavirus is going away. There's a lot of talk about vaccines. We will likely have a vaccine one day. Usually it takes years to gather enough data to say that a vaccine is safe enough, let alone effective, is safe enough to give to millions and billions of people around the world. A 1% fatality risk is unacceptable if you're giving a vaccine to 1 billion people. You're going to kill, 10 million people. So coronavirus is going to be here, and we're going to, as individuals, have to figure out how much risk is tolerable in their lives, how much we're willing to change our behaviors. And if you're in a bubble, I think you need to hug. I've been very fortunate to have, people in my bubble that have been around for this whole pandemic, and so I've had that human contact. It's so essential for our mental health. But beyond that, there are risks, and only you can say whether they are acceptable or not. And I wish I could tell you in any given situation what the percentage chance of having a bad outcome is, but it is impossible to calculate for every situation. And this is one of the hardest things about this pandemic. People want and deserve black and white yes, no answers, and unfortunately the science isn't there on such an emerging issue.
Yeah, I absolutely agree with you, Dr. Mackie, about the lack of yes and no answers. It was a real challenge, especially with the closure of essential workplaces, and we had so many business owners contacting our office to ask, can I remain open? Am I essential? Should I close? And they would call the provincial business line, and they would get different answers each time they called, and then the city was supposed to be interpreting and enforcing. So there has been a lot of this sort of gray area that has increased people's frustration. I think people appreciate as much clarity as we can give them. But a reminder to folks who are listening in, press *3 if you have a question. And next I'm going to go to Joyce, who has a question about testing. Joyce?
Yes. People are talking about getting tested, and my husband and I have not been tested. We don't even know where to go to get tested. So that's just the question I have.
Okay.
So
Dr. Mackie?
That's an easy one, Peggy. Thanks for the question. There are 2 assessment centers that are designed specifically for testing people of COVID. Testing people for COVID. They've been open in London since about mid-March. One is at Oak Ridge Arena. It runs Monday to Friday, 8:30 to 4:30, and then the other one is at Carling Heights. It runs 7 days a week, 11 a.m. to 7 p.m. So Carling Heights Optimist Center, just off Adelaide, and then Oak Ridge Arena are the 2 spots where you can get tested in London. This testing is available in hospitals, of course, for those who need it. In primary care, family doctors' offices, testing is possible, but none of the family doctors, with 1 or 2 exceptions of 1,000 in our region, have taken that up. But again, it's available. There have been, there is some wait time at the assessment centers, but it's certainly nothing like going to an emergency room. So Carling Heights or Oak Ridge Arena.
And Dr. Mackie, do you have to have symptoms, those shortness of breath or difficulty breathing, fever, those kinds of symptoms in order to get testing, or can anybody go and get a test?
Yeah, so that's really evolved, and early on we didn't have capacity to test everybody that wanted or even needed it. At this point we do, and so you don't even need symptoms to go in and get tested now. The caveat is, if you don't have symptoms, the test isn't supremely useful, because you may be negative one day and the next day you're exposed and you become positive a few days later. Or you haven't even already been exposed, it just hasn't showed up in your system yet enough for the test to pick it up. When you have symptoms, then the test can reliably tell you whether the symptoms are caused by COVID or not. But if you don't have symptoms, then all it tells you is in that instant that you got tested, you didn't have COVID. You may develop it the next day, the next hour. So our recommendation from a public health perspective is that testing is most useful when you have symptoms. In fact, it's about 24 to 48 hours after, a fever or cough develops that you're most likely to have an accurate test result. But it is available for those who might have been, exposed, maybe been to a gathering where somebody later tested positive, and you want to know for sure and be extra cautious that that is available.
Okay, thanks very much. Another reminder, *3 if you have a question. And next we have Anne on the line, and she has a question for Dr. Mackie. Anne?
Thank you, Peggy and Dr. Mackie, for what you're doing tonight. It's just excellent. So my question is, we've been working from home from our office setting, and we're having re-entry to go back. Some of us need to be in the office, and others want to rather than work at home, and some want to stay working at home. I have a situation where I will be in the office, but there's somebody else that wants to go into the office who lives with a frontline worker who works with respiratory issues for COVID patients. And I just wondered, how safe is that to be working with somebody who lives with somebody who's a frontline worker in the home?
So I'm going to suggest that that's actually pretty safe. And the reason is frontline workers are screened every day at least once. This is ministry directive. There's no way around it. What that means is that if that person becomes sick, then as soon as they're sick, all of their close contacts are isolated. So let's say, and it takes, let's say, an average of 5 to 7 days. So person gets exposed at work. 6 days later, they develop symptoms. Their close contacts are immediately isolated. So even if they have passed it on to their close contacts or are about to in the next, day or two, those people are isolated for 2 weeks. So that means you've got kind of 2 layers of protection, not just that individual working in a healthcare setting, getting screened multiple times a day, but also their family members immediately becoming isolated if they become sick. So of course, again, with anything, there's no way to eliminate all risk, so there is a chance of something happening, as there would be with any worker from any sort of background. The precautions in the office, I would hope and assume that your employer is doing some things to reduce the density of the office environment so that people are able to keep their distance within the office. There may be a policy and or you may choose to wear a mask in that situation as well. I'd avoid sharing food, even if you can avoid sharing food preparation spaces, avoid using the office kitchen if you can. Whatever you can to keep your distance and minimize contact with people in that environment. Those would be the things that help you the most.
Okay, thank you very much, Dr. Mackie. We now have a question from Pat, and I think this is an excellent question. Pat, are you on the line?
Yes. Hi.
Hey, do you want?
Hello. How are you both?
Great.
Hello.
We can hear you, Pat.
Oh,
yep.
Sorry. Okay. If and when this next wave hits, are we well prepared, and how bad is it going to get?
So, Dr. Mackie, I actually wanted just to say a couple of things about this. One of the issues that I am working on as an MPP is around paid sick leave. We heard Dr. Mackie talk at the very beginning of this town hall about the importance of washing your hands, maintaining physical distance, and staying home if you are sick. And I am very concerned that if there is a next wave and a worker, low-wage worker who has been, off the job for 3 months, is really worried about their employment, they may not be able to stay home if they are sick. They may not be able to afford to do that if they don't have access to paid sick days. So that is one of the things that I think we really need to do to prevent or minimize the impact of the next wave, because if people can't afford to stay home, if they have minor symptoms of COVID and they are out there with coworkers and customers or clients, I think we are in a very risky situation. So that's my 2 cents, but I'll ask Dr. Mackie to give his perspective.
Sure thing. So I think there are a couple of issues for discussion here. The issue of how well prepared are we for a second wave, and then what role does paid sick leave have? I'll actually maybe tackle paid sick leave first, because the other question is very complex and a really good question. I think it's on a lot of people's minds. Paid sick leave, no doubt, would help reduce the impact of not just coronavirus, but any illness that, influenza, as it comes through our community every year, pneumonia, any number of illnesses. Paid sick leave, no doubt, positive from a public health perspective. There are impacts from an economic perspective, and when this political sort of decision is made, obviously it's things beyond health that would be considered. But from a health perspective, paid sick leave, there's no doubt that it has public health value. How prepared are we for future waves? Well, we have coronavirus here in our community now. And the rate of spread is quite low, and the rate of death is even lower. We've only had 1 death in the last 3 weeks, more than 3 weeks. Obviously, we prefer 0 to 1, but in the previous 2 months, we had 56 deaths in the previous 2 months. So 1 a day to 1 every 3 weeks, big improvements. We are handling things well now. As the economy continues to reopen, as schools open in the fall, and as the seasonal impacts change so that people are indoors more, we are likely to see another wave. And the question preparedness, so let's look, there's kind of multiple layers to the question preparedness. First of all, do we have adequate capacity in the healthcare system? I think the answer there is yes. If we're able to do the dramatic things that we did in terms of shifting patients around, forcing different healthcare institutions to work together to support each other, those were tremendously effective. You know, we built a hospital here in London at the Western Fairgrounds that was never needed. So the capacity was there when we had to. The one question there is, you know, how many overtime shifts where people work. We did build the hospital, but we didn't have the staffing laid out. So, you know, more nursing staff in particular would help us be better prepared from a healthcare perspective. But again, that first wave, we were not overwhelmed in any way. Beyond that, the healthcare impacts, you know, we talked earlier about access to medical grade masks. That would make a difference. If we had a domestic supply of adequate medical masks for everyone to use when in public, that would make a big difference. I don't think we're there. We may be closer to that. You know, there is capacity ramping up around the world to produce that sort of product, but we're definitely not there at this point. Then, you know, we won't have a vaccine. That's almost certain. There won't be a vaccine in place at a scale to protect the whole population by the time we have the next wave. So we can't count on that. And then I think there's a real psychological, emotional question that is open in my mind, and that is, you know, would people be prepared to take similar sorts of dramatic changes, actions, closures, changes of behavior that we did over the last few months? Would people be willing to do that again in the fall or next winter or next year when the next wave comes? And I think first of all, that was most of what helped us end the pandemic. People changing behaviors and organizations, you know, closing their doors. That's what really dramatically reduced the number of contacts that each of us have each day. And that's what reduces the spread of this sort of illness when you have nothing else. You don't have a vaccine. You don't have treatment. So that was a crucial factor, and I can't honestly say that I'm confident we would be able to do that again. Not just emotionally and psychologically, but financially as well. So many people took such huge financial hits over the past few months, and could they do that again in a year without, you know, I think it would require major financial support across the country. You have seen questions like universal basic income come back into the conversation around coronavirus to really help us all get through this. You know, that would be another major factor that I think government should be thinking about from a policy perspective.
Okay, thank you very much for that, Dr. Mackie. I had mentioned CERB at the beginning of the hour, and you know the support that they provided for people who were desperate about how they were going to get by with their job, their workplace closed down. And I think that has really started a conversation about what people need, what makes a livable income, because the federal government set the CERB amount at $2,000, which is much higher than people get on Ontario Works or ODSP. And you know, you were chair of the London, the Mayor's Task Force on Poverty, and you know how many people are living in poverty because of because of the low rates for income support. So I fully agree with you that that this whole COVID experience has triggered an important conversation that we need to have about how much income people need, and making sure that governments step up to provide that. So I wanted to go next to Todd. Todd has a question about COVID tests. So Todd, go ahead.
Thank you for taking my question. So my question is about people who have had negative results from COVID tests. When will they be getting the antibody test to see if you had COVID?
Super. So there is a test, blood test. So the standard coronavirus test is a swab that goes basically in your nose, and it tells you if there's virus in your body. Now, the antibody test is a blood test. You get a blood sample drawn, and it will tell you if your body has mounted an immune reaction to coronavirus, which is an indication that you've had COVID in the past. The antibody test is not useful for diagnosing in the moment. It takes about, on average, 28 days for antibodies to show up in a person's blood. And even at that 28-day mark, when it's most likely to find antibodies, only about half of people who have tested positive for COVID through the swabbing will be positive from an antibody perspective. So that means that not everybody develops that immune reaction, and it's not reliable either as a diagnosis in the moment because of the delay, or to really know for sure if you had COVID in the past. So from a public health perspective, we really haven't focused on the antibody test for those reasons, the limitations of the test. Would it be useful? Would it be interesting to know? Absolutely. It looks like that will become available in the coming months. There is actually some availability of the test through online sources out of the U.S. It's not licensed in Canada yet, but I've heard that you can get it that way and get it sent to a lab down in the U.S. for analysis. But yeah, it's not one where we've put a lot of our efforts just because of the basic limitations in the test. And the swab, the nasal swab, is actually very accurate. It's well over 90% accurate. So it's one that we've really relied on.
Okay, thank you very much, Dr. Mackie. I can't believe it, but we are out of time. So I want to also say thank you to everyone who has joined us on the line. You have asked some great questions. Obviously, a lot of interest in testing and how do we protect ourselves in this, this new stage that we're in with the economy reopening. So if we didn't get to your question, you can leave a voicemail message at the end of this call, and we will get back to you. We also have the questions that were submitted online, and we can respond to those. And finally, I want to invite everyone, if you would like to receive my my weekly newsletter, you can email me at psattler-co@ndp.on.ca if you would like to be added to my mailing list. So once again, I want to say a huge thank you to Dr. Mackie for taking time out of his busy schedule. There's obviously still a lot of information to be shared. People continue to have a lot of questions, and we're very, very grateful to have your leadership in our community, and I know that you go above and beyond to communicate with people and to try to get that information out there. So thank you so much for joining us tonight, and I hope everyone has a great evening.